The single most complex human endeavor of our time is the creation of health for entire populations at a national and global level. That is incredibly complex and difficult work, and it is the work of health system leaders and policymakers. But to get it right, you actually need the contribution of everyone in the system: patients, providers, research, academia, industry, and civil society. In the world, there is only one platform that brings all of these stakeholders together around one common evidence base of what works in healthcare innovation. Across the next 2 days, leaders from 110 countries will be right here in Doha at the World Innovation Summit for Health.
A lot has happened since 2013. It's gaining momentum. This wish is bigger and better. It's bigger in terms of the representations globally. It's better in terms of the evidence-based outputs, which is really our marker, it's our USP.
Science is going to drive the way we think and the way we respond. And if we can either ignore it, or we can say, okay, that's a wake-up call for us to start addressing these issues so we can take advantage of the science.
Everyone can influence this. You and I can. There aren't many places where industry, academia and policy come together as equals and can share.
Health is about the encounter of people. People who have a disease or a health need, and then another group of people who are the doctors and nurses, the professionals that actually take care of the first group. They meet and the professionals mobilize technologies. And at every step of the way, if you think about that human core of health systems and education systems, every step of the way is amenable to innovation, and it's in desperate need of innovation.
The majority of years of healthy life lost are from behavioral and lifestyle factors. It's really good that a forum like WISH actually does that and says, well, if that's the case, what does that mean for our healthcare system? As opposed to just sticking in a kind of comfort zone of, let's just worry about kind of conventional medical practice, in terms of, which is normally picking up the pieces, as opposed to saying, where are the real causes? Where does it come from?
Ultimate aim is to promote health equity and reduce equity gaps between nations and within nations. We have to make all innovations not only highly relevant and impactful, but very affordable at the level of the national health systems, as well as to the individuals if necessary.
The world of scientific exploration in all sorts of new fields, genomics and precision medicine and immunotherapies, I mean, that just offers phenomenal possibilities at all levels of the healthcare system. The range of thought here about, healthcare and innovation and, yes, deep specific disciplines, but also how there's cross-disciplinary thinking and where you can really borrow best practices from one to aid with the other.
Everything is a product of our human intelligence. And so if we could somehow distill some components that make up this intelligence, if we could take the essence of our intelligence and distill it into an algorithmic construct, one that can benefit from incredible access to large data, parallelization from compute, perfect memory storage that we get in silicone, perhaps we could use some of these insights to try and make the world a better place.
Creating an environment which these guys are safe to fail, where they will come up with an innovation and it doesn't work and you celebrate the search, that's key. If we're not failing half the time, we're probably not learning.
The best ideas we know will always come from those who've dedicated their professional lives to the health of others. And with WISH as a platform, we can all collectively realize our vision of a healthier world through global collaboration.